how to get rid of low back pain and start running again, even if you've tried everything. So I've been told that running is bad for your back, that you just have to just rest, or worse, give up running altogether. Maybe you even had an MRI and saw words like disc degeneration or arthritis and thought, well, guess I'm done running for good. Well, that's a lie. And today I'm going to show you why. So I'm Dr. Ray Peralta. I'm a physical therapist and run coach and certified in the McKenzie method. And I've been working in this field, helping people with back pain get back to running pain-free for the past 10 years. And in this video, I'm going to break down the 8 biggest false beliefs keeping runners stuck in pain and what you can do to fix your low back and get back to running again safely, even if you've been hurting for months or years. See, low back pain affects up to 84% of adults. For runners, it's one of the top reasons people stop training altogether. The U.S. spends over $100 billion every year on back pain, yet most people never get real relief. Why? Because they've been sold a bunch of these, false promises that sound good but aren't true, right? And sometimes even doctors perpetuate some of these myths because they're relying on outdated research or outdated data. They've been trained in maybe in medical school some outdated, treatments. So myth number 1, you have to give up running. So if you've ever been told you shouldn't just run anymore, let me just say, unless you've had like a spinal fracture and a spinal infection or a tumor, you absolutely can run again. Even if you had a herniated disc or arthritis or stenosis, it doesn't mean that your running life is over, right? You may need to pause for a bit, but quitting forever, that's just bad advice. Again, unless you had like a spinal cord injury where you're like paralyzed from, the waist down, something traumatic as that, most cases of low back pain, you can get back to running. Again, you may need a temporary break from running, but that's a different story. Not as opposed to like some common advice like, oh, you have this disc herniation, now you have to give up running altogether for life, right? That's typically not the case. Myth number 2, arthritis is equal to pain. So look, spinal arthritis just happens with aging, kind of like graying in the hair or wrinkles in the skin, right? X-rays show degeneration in people with pain, but also people who never had pain. So arthritis on your skin doesn't mean it's the source of your pain. And oftentimes that's a misdiagnosis just waiting to happen. Like oftentimes that's like a doctor's default diagnosis. Like, oh, your back pain's from arthritis. You have disc degeneration in your back, which is typically just normal age wear and tear. Another myth, this MRI will tell you what's wrong. Here's a wild fact. 40% of people with no pain have disc bulges on MRI. Even elite athletes, they may show a pars, a fracture, a stress reaction, and even degeneration or slippage in their spine, and yet feel totally fine, right? MRIs can actually lead you in the wrong direction, which in so many people, they get misdiagnosed and then get mistreated, and then leading into a pathway getting treatments that they don't need, maybe a surgery that they didn't need, or even injections they didn't need. Myth number 4, low back pain will go away with rest. So a lot of times, a lot of doctors were taught in medical school that, hey, just give it 3 months and that pain will go away. The thing is, it's based on a single study published in the 1950s that never even followed up with patients. They made this false conclusion just because patients didn't follow up that the back pain went away in 3 months. And yet still, this belief system guides most doctors that, oh, it'll just go away on its own if you just wait 3 months. But why is low back pain the number 1 cause of disability worldwide? If you look up global cause of disability, low back pain is worldwide cause of disability. How is something that just goes away on its own based on the study the global cause of disability? That's because that it's a myth that back pain will just go away with rest, bed rest alone. No. Oftentimes the back pain will persist or recur. And then the minute you start picking up your activity, you go back to work, you start running, or even just commuting to work, the back pain returns again. That's because back pain oftentimes doesn't go away with rest. And then some people think, oh, I just have to live with this back pain. It's just part of my life. It's just, I just have to live with this chronic back pain and just accept it. And that's because they don't know how, oftentimes they got mistreated. They went to doctors who didn't know how to properly treat their back pain. Surgery is another myth, right? Myth number 5, surgery is the only way. The thing is, 50% of all back surgeries are necessary. And even when you do get surgery, it fails up to 40% of the time. It's actually something in the healthcare field called failed back surgery syndrome, failed back syndrome from surgery. And you don't want that, trust me. It's because now so oftentimes this pain is compounded by the pain from surgery. You get this post-surgical pain that now it's persisting. Now it's a chronic condition, and you thought the surgery was supposed to fix it. And oftentimes you didn't even need a surgery in the first place. All right, again, assuming you don't have one of these serious pathologies that we talked about earlier, like a tumor in your back or something like that. So, myth number 6, I need fancy treatments. You don't need cupping, you don't need lasers, electrical stimulation, 10 plus 20 visits to the chiropractor or a massage therapist. Yes, those things may offer temporary relief, but most back pain is mechanical, right? Both acute and chronic back pain is mechanical, often in response to very specific movements and loading strategies, not some fancy gadgets or a quick little manipulation or adjustment of the back. Now, again, those things can provide temporary relief. Of course, I'm not downplaying them altogether, but they shouldn't be your main focus of treatment or your thing that you rely on to get relief from your back pain, right? You don't want to be popping pills all the time or getting laser treatments to your back all the time. Myth number 7, I just need to do core work. Don't get me wrong, I'm a big fan of strength training, and core strength is great, but a weak core isn't the reason you have back pain. In fact, many people with back pain are actually over tensing their muscles, actually in a state of over too much tension or spasm in the back. The key is learning how to move and load the spine properly. That's where MDT, the McKenzie method, comes in, something that I'm actually certified and have a diplomat in the McKenzie method that will actually help people move the spine properly. It's not just about doing a bunch of sit-ups and stuff, and oftentimes doing a lot of sit-ups will aggravate, in many cases, low back pain. So the truth, what to do instead? Again, you want to work with someone who's certified in the McKenzie method, MDT. And someone like myself will help you figure out what movement pattern that helps you relieve your pain. And now sometimes it's extension, sometimes it's flexion, sometimes it's side gliding, sometimes it's even rotation. But it's never just guesswork. We do a proper mechanical assessment to really break down what's actually contributing to your pain and then seeing where you respond. And sometimes it's a mix of different strategies. But once we understand how the pain behaves, we can help you calm the pain down. And many people can actually get relief from their back pain in as little as 3 to 6 weeks with the right exercise, because the right exercise matters. I've helped many of my runners safely return with a run-walk protocol. Once they calm the pain down, their pain's like at a minimal level. Then we start with the running portion, something as simple as that 10-second run, 50-second walk. And then we gradually start building up, going to eventually a 5-minute run, a 1-minute walk, and then continuous running. And then they're able to, do like 20 or 30 minutes of continuous running, or even go back to whatever they were training for, whether it's a half marathon or marathon. So I've helped hundreds of runners recover from chronic back pain without surgery or pain meds or having to rely on going, to multiple different alternative therapies. Like they don't have to do a whole ritual of cupping and cold plunges and lasers, right? I've even had runners go from, I can't even walk without pain, to racing half and full marathons again, right? It does matter the right exercise you do and getting the right method. Because sometimes people are like, but I tried PT in the past, it didn't work. Oftentimes because the PT wasn't trained in this McKenzie method of mechanical diagnosis and therapy. You have to make sure they're certified, or even better, if they have the diplomat, like I do myself. And if you want to learn more about this, there's a great book, a resource from the creator of the method, Robin McKenzie, has a book called Treat Your Own Back. It's a great book, but sometimes people get stuck trying to do the book on their own and they need additional guidance. And that's where working with a trained expert comes into play. So if you're dealing with stubborn low back pain and want to run again, I put together a free training that walks you through exactly how to break free from the pain and finally start running strong again without fear of having to rely on pain meds, injections, or surgery. Just click the link below and check it out now.